As medical research and technology advances, so should the treatments. But you'd be surprised at how many medical providers are still using old treatment methods, which cause patients unnecessary suffering and financial burden. Dr. Charles Moak joins us today from Allure Medical to talk about a particular type of leg pain and why their innovative, non-invasive treatments have had such a high success rate. Welcome to the show.
Thank you.
And what particular leg pain are we talking about today?
So there's a condition, it's called venous insufficiency, and it starts out in a lot of cases with varicose veins or just swelling. And then over time, the legs get heavier, they start maybe turning red or getting brown spots, and eventually they can get sores. So we have different phases of it. One could be just varicose veins that look unsightly. And then there's ones that might be painful, swelling, skin change. It's progressive. It gets worse about 4% per year.
And so we're taking a look at those right now. At what point do you go to your doctor or to come in particular to Allure?
That's a great question. Right about the middle where it says C3 swelling. Once they start having symptoms, so a varicose vein is probably fine. If it bothers you, it doesn't really bother you, it's fine. But if you start getting swelling, heaviness, achiness, discomfort, it's going to get worse until you finally get open sores.
I mean, how does that happen, though? I mean, the varicose veins, I mean, how does that lead to open wounds, the ulcers like we just saw?
Yeah, that's a great question. So what happens is that we have a heartbeat, and that pushes the blood down to our feet and our hands, and that's what our pulse and our blood pressure. Now the blood's got to make its way all the way back up. And it goes through a series of one-way valves that open up to let the blood through and snap shut. Well, the ones inside your muscles are pretty strong, and they have muscles surrounding them, milking it back up. But in the skin, they rely 100% on these one-way valves, and some of us, they just fail. When the valves fail, the blood just sits there, stagnates, your body responds by trying to grow more veins, which is a varicose vein, and then when that doesn't handle it, then the skin starts breaking down.
So then what is vein treatment like at Allure Medical?
So you come in and we do a free screening to see if you have it or not, and then if that's the case, we do an ultrasound that lets us look through the skin and see what's causing it. We really find almost like a roadmap right where the cause is. Usually one or two spots that caused everything, blood's not working properly, and your body's been responding by growing more veins, and then we actually use a procedure that burns it. You don't feel it, but it burns it, goes away forever, and then the leg just heals.
And I think this is a really important question, does insurance cover the treatment?
Yeah, insurance covers it, even Medicare.
No kidding.
Yeah.
Because that was something I said in just introducing you. I mean, there's a financial burden, and if people don't know about Allure Medical.
The burden is actually enormous. So what happens right now is we're really going after the more severe legs. That's what we're trying to stop. And right now, in the United States, we spend about $16 billion a year managing venous stasis wounds. These are where people get sores in their legs. They're in wound care center pretty much the rest of their life, and it costs about $24,000 every year with hospitalizations and the wound care. But the treatment, the cure, was invented about 12 or 15 years ago. It just hasn't caught on in a lot of areas. They're still doing wound care rather than curing the problem. So we like to catch it a little earlier, but even if somebody has a sore, we still treat it the same way. It'll heal up and it doesn't come back.
You just said that it hasn't caught on yet, this treatment that's out there. So then how did Allure become a leading place for vein treatment?
We were actually doing this from a cosmetic standpoint, treating varicose veins, and I started having people with sicker and sicker legs, and I worked with other doctors in the country that we developed the techniques to treat the more severe legs of venous ulcers. So we've always been doing it. And I found out a few years ago that Michigan was kind of unique, particularly my city, of treating these more advanced legs with modern treatments. So we looked at around the country where we're still doing things the old-fashioned way, and we're going to try to change the behavior community by community.
One of the things I also love about Allure Medical is, and I'm just going to read this, we believe in curing the root problem, not just managing its symptoms.
I think fundamentally healthcare has been around managing disease, and we got to shift this to getting rid of it, making disease optional.
And I know you have a lot of very happy patients.
For sure.
And because you're literally giving them their lives back.
Absolutely.
Rewarding what you do, Dr. Moak?
I love it.
Okay, well, thank you for taking the time. That's great information, especially that piece about insurance, and that's important. For more information on Allure Medical and to schedule your free leg screening, just go to alluremedical.com or call 215-0982. And Allure Medical is located off of Dutchman's Parkway?
Yeah, right in Hospital Row.
Hospital Row. We'll be right back with more Great Day Live.